And welcome everyone to this webinar titled Integrating the Social Determinants of Health into Health Workforce Education and Training, What Relevance for Planetary Health and Climate Action. As you all know, climate change presents a fundamental threat to human health. It affects the physical environment where people are born, grow, live, work, and age, and the ecosystems on which communities depend for their livelihoods, their health and well-being, and their very survival. Therefore, climate-sensitive health risks are disproportionately felt by those living in situations of greatest vulnerability and disadvantage, including in this category poorer communities, particularly women and children in those communities, migrants or displaced persons, older populations, and those with already underlying health conditions. Addressing the social determinants of health at a policy level really involves actions that go to the root causes of structural discrimination and public policies that are impacting health inequities. We know this approach is often termed a health in all policies approach, and it really aims to go and improve governance for health equity, which is integrally linked to governance for planetary health. And it's with this background in mind that we've convened this webinar around a new publication which WHO launched just over a month ago, called Integrating the Social Determinants of Health into Health Workforce Education and Training. We believe this action for integrating social determinants into the health workforce is really fundamental to contributing to the changes needed for planetary health and climate action. So today with me, I'm delighted to say I've got a fantastic group of people who are going to talk you through a lot of the themes and issues that are discussed both in the area of education and training, but also in the links between social determinants and climate change and climate action. So after these opening remarks, I'm going to be handing over to my colleague Onyema, who's going to, and Julian, who are going to launch a keynote speech, which was pre-recorded by the Director for Health Workforce at WHO, Dr. Jim Campbell. After that, we're going to go into two setting the scene presentations, one from Ezekiel Manuel from the University of Pennsylvania, and another from Julian Fisher from the Hanover Medical School. Together, Julian, Onyema, and myself have been working on, for the last few years, on the publication Integrating the Social Determinants of Health into Health Workforce Education and Training. And Julian has played an instrumental role there. After that, Julian will be facilitating a group of panelists who are coming from both the University of Pennsylvania, the University of Bergen, from our own headquarters workforce department in the face of Onyema. And then we'll also have someone who's talking from the government of Qatar. So that's the lineup for today. We hope that you enjoy what we're going to be discussing. And we hope that through this webinar, we can really illustrate the importance for joint environment and health action to address climate change and health equity. So now, without further ado, I'm going to hand over to, I think, Julian or Onyema, who are going to launch the talk by Jim Campbell from WHO. Thank you.
Madam Chair, distinguished panelists, colleagues, ladies and gentlemen, a warm welcome to today's session on integrating the social determinants of health into health workforce education and training. It's a real pleasure to join you and give you a few opening remarks to help set the scene and the discussion going further forward. My name is Jim Campbell. I'm the Director of the Health Workforce Department at the WHO headquarters in Geneva. And it's been a pleasure to be accompanying the work that we're discussing today for many, many years with some of the panelists and speakers accordingly. Let's just put the work into context of where we are today. We have just passed the halfway point of the Sustainable Development Goals, June the 30th, July the 1st this year. And the Global Monitoring Report was published and discussed at a high-level meeting in New York around universal health coverage. What have we experienced in this first 7.5 years? Well, it's been a period that's dominated by public health emergencies of international concern. H1N1, the Ebola virus, the Middle Eastern respiratory syndrome, and more recently, the global COVID-19 pandemic. At the same point in time, we are experiencing, new records around climate-related disaster, around, the hottest day ever on record, only to the next day to be beaten by an even hotter day on record. So climate-related disasters, emergencies, records prevailing and dominating the situation. And at the same time, then these impacts coming together, we're seeing stagnation and regression in life expectancy, in access to universal health coverage, and with global economic situations, more and more people finding it harder to access healthcare without experiencing financial hardships. And that's where we are at the halfway point of SDGs, and why we must use this opportunity of COP28 to start to look at these agendas in a holistic way. How do we put climate, public health, social determinants of health, health systems and health workforce together in an integrated manner? And we need to do that in an intentional way. We have resources to help us do so. We have seen through this last 7.5 years of the SD period a re-emphasis on the essential public health functions, things that have been with us for decades, if not centuries, in global health and public health. Those essential public health and greater consensus on these obligations of government, society to actually do certain things. For instance, protecting population from health threats, preventing disease and the spread of disease, ensuring that we are prepared for and able to respond to any public health emergency, whatever that may be, whether that's an outbreak, whether that's climate related accordingly. So how do we put this work together and ensure that we have a health system with a health and care workforce that is competent to drive change, to affect change with individuals, with families, with communities, with the health systems that exist? So we come back to those public health principles, not in an isolated way over a single issue, but as an integrated way around population health. And that's what we've tried to set out to do across the World Health Organization. We've seen the new resources available just ahead of COP28 on how do we build climate resilient and low carbon health systems. That emphasizes the necessity for the health and care workers within those systems to be climate smart, climate competent. It emphasizes then in the work we're doing on essential public health functions and a roadmap to build a public health and emergency workforce of the future. Again, the essential competencies that will be needed in health and care workers and their different occupations, their different practice activities, the tasks that they are educated, trained for, and supported to deliver. And this resonates again then when we start to come into this new tool, this new resource that has been compiled with experts all around the world, looking at how do we look again at these social determinants of health and ensure that our workforce has the competencies to affect change. It's underpinning much of our work around universal health coverage, health security, population health outcomes, to come back to this education and training. But it's not just training for training's sake. It's actually looking at how does our education system around the world, how does that produce practitioners who are committed to lifelong learning? How do we look at ensuring that we're able to affect change in practice? So it's not the training time, it's not the training episode, but it's the behavioral change in practice that is our most issue of most concern, so that we can see the investment in knowledge, in skills, in competency translate into better practice behavior, better population health outcomes. I'd like to acknowledge and really give thanks to the team that are involved in all these resources and tools that really bring this sort of societal health, the planetary health, the climate health agenda together under this broad umbrella of public health. And it really then enables us to take this step further and look at education, competency, and the workforce of the future to make change. Thank you again to everyone involved in that, and particularly the social determinants piece here, for all the efforts to take this work forward. I'd like to really thank you for those endeavors and wish you an excellent deliberations today, but more importantly, to actually turn evidence into policy, into practice, and behavior change. That's what we're looking for to impact everyone's access to health and well-being for the future. I thank you.
You're muted.
Following those stirring words from Dr. Jim Campbell, I now have the pleasure to invite our two setting the scene speakers who will be speaking to us live. The first is Dr. Emmanuel Ezekiel. Dr. Ezekiel, over to you.
Thank you very much. And it's lovely to be invited. And I do want to commend the WHO for this report and for thinking about the importance of training physicians and others in the social determinants of health and how climate change will impact them and therefore impact patients' health, and how to think about addressing them. That kind of training is woefully lacking, and it's something I'll comment on in a second. We've known for decades, centuries even, about the importance of social determinants in and the environment in how it affects people's health. For instance, we've known that people who are well off live a lot longer than people who are more with lower incomes. Since the early 19th century, 200 years, that factor has been known. And we've been able to quantify exactly how much of things like longevity and lifespan are affected by the social determinants of health, and the fact that they, social determinants of health and the environment, affect people's health much more than health services. Climate also has a huge impact on the social determinants of health, and we're learning that much more as time passes. It affects the nature around us, the greenery we have, the coverage, the parks, the trees. It affects our water and food supply. It affects the vectors all around us and their reach. And finally, it obviously affects the environment in terms of the temperature, the increase in temperature. As you noted, we've had the 2 hottest days in human history, floods, other catastrophic events. And we have seen in just the past year, huge unexpected events like tremendous forest fire in Hawaii because of induced partially because of climate change. I would say that certainly in American medical schools and nursing schools and other health schools, there is not a sufficient attention to training. There's not even a lot of training about climate, much less how that's going to affect patients' health and how to deal with that. We know that it'll increase infectious diseases. We know it'll increase cardiac stress, respiratory issues, but we do not educate our students yet on this. And that is, I think, the fundamental importance of the climate report released. what can we do in terms of the workforce and recognize the impact or the interrelationship between climate and change and the social determinants of health? One, I think, is training them for how to prevent some of these calamities from happening, reducing people's vulnerability, insulating people to the extent possible from the impacts of climate change on the social determinants of health. A second is how to treat patients who suffer from these effects and have adverse health outcomes, learning what the consequences are, learning the treatments, and learning how to intervene in a evidence-based way. And the last, and maybe ultimately the most important way, is to teach people how to be advocates for their patients, for their communities, in terms of trying to change and have adaptations implemented to mitigate the impact of climate change on the social determinants of health and to reduce the adverse impacts. I think this is all essential parts of what we need to do in terms of training. I want to just talk for a few minutes now about the Penn experience in terms of climate change at the university and how it's been integrated into an institution of higher education. One of the things we have done is to take the SDGs and to map across all the research and educational efforts that are related to the SDGs, using the SDGs as a framework for understanding all of our climate initiatives and how they impact the achievement or undermine the achievement of the SDGs, and figuring out how we are contributing to recognizing ways of furthering the SDGs. They provided an intellectual and assessment framework, which I think is very, very important. Second, I think you mentioned it, Nicole. I had what's called Penn Global. This is our institutional vehicle for addressing global issues. Students study overseas and research overseas, as well as funding faculty research. Now, we've used this assessment of the SDGs in research to have a call for proposals about how climate change will affect the SDGs, and prioritizing the proposals based upon their impact on climate and the SDGs. In 2023, we awarded 19 different grants, and I would say that more than half of them are related to foci on inequality and reducing inequality from the impacts of climate change. So we've taken very seriously the framework provided by the UN and the WHO, and used it to guide our assessment of our own activities, and then where we can make additional investments to augment the research efforts for addressing climate and climate's impact on SDGs. I would say another major area we've had is to impact this educational of our Penn students, and using climate and climate experience to have students learn about the social determinants of health and learn how we can, again, affect those social determinants of health. We've done this through summer research programs where students can go overseas to places being adversely affected by climate, studying and not just receiving information, but also conducting research and augmenting ways of addressing climate change. This is primarily, but not exclusively, but done by addressing small island nations that are affected and are going to be most immediately affected by climate change. Finally, the university has undertaken a action plan on climate, focuses this, has been done for the last 10 years, since 2009. And the advantage of the university undertaking a comprehensive action plan is, first, that it is comprehensive. It looks at everything from securing energy, heating and cooling for the university, to how we construct buildings, to how we operate the buildings, and how we have waste and how to reduce our waste. It also provides an excellent focus for schools. Each individual schools, and at the University of Pennsylvania, we have 12, everything stretching from the medical school and the veterinary school, who we'll hear from on the panel, to our School of Social Work, Education, and Communication. And this comprehensive university action plan on climate allows us to focus our efforts and make coherent across the schools training in terms of the curriculum offered students, research of the faculty, and ensures a unified approach to operations, all to address climate and our impact on climate. I think this has led to some important new initiatives by the university, as well as upgrading some of the initiatives we've had and making them more ambitious over time. I think what we do at the University of Pennsylvania, I hope, is at the forefront of what universities are doing. Most importantly, I hope that we can hold ourselves accountable to assess how we're impacting the climate, impacting our students' education, so they are better prepared, especially in the professional schools, for going out and doing what they can to address climate. And I look forward to actually taking this report and augmenting what we're doing at the University of Pennsylvania in terms of medical education and nursing education for our students, so that they are prepared to address the climate's impact on social determinants of health. Thank you, and I look forward to further discussion.
Thank you very much. That was a super illustration of what can be done on the ground by education institutions. You talked about equity and prioritizing equity in climate research, with the in looking at that call for proposals and research that you did. There we see a clear integration of equity and social determinants into climate impacts assessment. You also talked about the actual training you're doing and how you using climate change issues and then casting an equity lens in that context, which I think is a super way to combine the two for training. And then the actual actions you're taking on an institutional level in terms of your own internal processes, I think is very, very illustrative of what WHO is also promoting with health systems worldwide. So thank you for that, that very inspiring talk. And I'm now going to turn to my colleague Julian Fisher from the Hanover Medical School, who's going to present more on the actual publication. Over to you, Julian. Thank you.
Julian, I think you're muted.
Thank you very much. Yes, well, thank you very much. And a great thanks to WHO for putting this session together, and on behalf of the team and also from the University of Hanover, the medical school, thank you much for the invitation to speak about the work that we've been closely involved in. The Hanover Medical School was given the contract several years ago to produce this guide. So again, an opportunity to thank WHO for creating this guide, which I think is an absolute essential piece of work for what we're facing, particularly around some of the issues that we've been setting from Dr. Campbell and Dr. Emmanuel. So I would like to talk really about the guide itself. So you've got a picture of the guide. It's on the WHO website, and particularly emphasize one of the most important diagrams in the guide, as you see on the right-hand side, because it really resonates with what Dr. Campbell was mentioning, that there are going to be a new set of competencies that we will need to integrate and to give to the health workforce. Because he was just saying, we're getting records broken, and health workers around the world are being confronted with extreme situations, flooding, drought, food issues, and they're going to need the competencies and skills to work in those situations, and also, as Dr. Emmanuel was saying, also advocate at a national and global level for policies that help them do their work. And again, as Dr. Campbell was saying, there's absolute sense of urgency. We need to move very, very quickly. And one of the things that this guide is doing is highlighting that public health, perhaps, and I know Dr. Tiliskar will be talking about this, public health has been something, or global health and public health has been something seen somehow external to health workforce education. And we really need to bring this into and encourage medical, dental, nursing, pharmacy, all the health professions to see this as an integral part of their learning. And how do we integrate? And that's something that Dr. Tiliskar and I will be discussing in the panel session. And one of the key aspects of this guide, obviously, is going, as Dr. Emmanuel was saying, right from the Sustainable Development Goals. How are we going to, they're a tool set of analyzing and developing solutions for these complex problems. Then we're going to look at the advocacy that Dr. Campbell and Dr. Emmanuel mentioned. How do health workforce start advocating for health? And obviously we have now a unique opportunity at COP28 to start doing that. And the guide itself, drawing your attention down to the left-hand side of the slide, has included food systems and housing. And one of the reasons that we've done this is to emphasize that obviously decisions and issues in sectors outside the health sector have a tremendous impact on our health. And it's important that we know how to work with the other sectors when we start trying to solve these problems and issues around climate change. And the other thing is that we need to, again, think of the macro level. So what can we do at a global level, and link that, and this is what the guide tries to do, link that to I'm a nurse or I'm a midwife in a practice, and make sure that all those skills and competencies are linked to enable people to work collectively to solve some of these, or to solve these big problems. And if you look at the thematic program in COP28, obviously it's the first time that health has been engaged, which is excellent, but you've also got other thematic areas, nature and land, agriculture, food, and particularly multi-level action and transport. And Dr. Professor Hoffman from the School of Veterinary Medicine and I will be discussing the link to food, the fact that we need to start moving away and looking at transdisciplinary education, which Dr. Emmanuel mentioned, so that health becomes the role of not just the health professions, but other professions outside the health sector. And I think because of what's happening around climate change, we've had health in all policies. So it's perhaps traditionally been seen as at a national level. And now with COP, the guide enables us to start looking at those health in all policies at COP. How do we operate as health professionals, as health workers, in a multisectoral environment where you've got transboundary issues, you've got a lot of complex discussions that often, as we've been hearing, don't fall within the current competencies, skills of the health workforce. So we really need to look at this global level and also of the national and local level as well. So it's really expanding the idea of health and health in all policies. And as Dr. Emmanuel is saying, one of the key tools that we have are the Sustainable Development Goals, the 17 Sustainable Development Goals developed by the UN in 2015. And again, University of Pennsylvania started mapping those sustainable development goals, not just in the health faculties, but in business, in engineering, and design. So there is a sort of cohesive, collective framework for transdisciplinary education. And what that enables us to do is, as we were saying, take those big global decisions, but using the Sustainable Development Goals, work together at a national level. And this is an example on the right from Germany, work at a national level, a regional level, and right down, in actual fact, in the local area, local municipality that I'm working in. So the role of the health worker can be linked through the Sustainable Development Goals right up to the global level. And the other thing is, the Sustainable Development Goals are a very good teaching tool because it enables us to understand the viewing point, where people are, and also people's points of view. If you go into WHO, quite rightly, WHO puts health in the middle. If you go to the United Nations Environmental Programme, they use the two Sustainable Development Goals for the environment, and so on, food and agriculture, and the ILO, the International Labour Organization, puts workforce and employment at its center. So the goals are a way of us understanding these complex issues from our own perspective, but understanding the perspectives of others. So again, mapping, as Dr. Emmanuel was saying that University of Pennsylvania have done, is a really important, from my perspective, a really important step to integrating the social determinants into health workforce education, because we can do this on a global level. And the other thing that perhaps we might want to consider is the UN document from 2015 on the Sustainable Development Agenda talks about the 3 dimensions. And perhaps that's what we're most familiar with, the social, the environmental, and the economic. But it also talks about 5 action areas of critical importance to humanity and the planet. And potentially, we are in an era, in a time where we need to move to much more action-orientated ways of looking at the Sustainable Development Goals. On one of the on the right-hand side, that's an example. You've got people, planet, prosperity, peace, and partnerships. Again, those 5 areas, and you can distribute the Sustainable Development Goals across those 5 areas. And one of the interesting things that we can do there is we can then start linking it to work, for instance, in the European region, we're looking at sustainability reporting. So you can then start linking the work of the health sector to a macro regional effort to start getting industry, to start getting hospitals to become more sustainable. And as you can see, environment, governments, social or human rights fit very, very well with the social determinants. And again, the guide enables us to have common metrics, common standards to begin those conversations. What we're seeing is the development and the beginning of a common direction of travel, and the Sustainable Development Goals and social determinants and how we address those now starting to be cross-pollinated into other areas, into other policy areas and strategies. And the other thing is that the health social determinants is often seen as a community practice, but health in all policies is perhaps always perceived as something as a global or even a national level. And what we need to do is see health in all policies at a community level, because that's where health workers can start looking at local policy and feed back up in a structured way to national and then for global policy, and vice versa. Those policy decisions at a macro level can be then transferred down to a community level, and the health workers, hopefully having used this guide and been educated on the guide, know how to work at a local policy level and understand the linkages to global decisions. So again, health in all policies, bringing that right down to a skill set and competencies, as Dr. Campbell was saying, right down at the community level. So in a nutshell, this is what the guide aims to do, is to provide a broadening of the health workforce education, create an understanding of how the Sustainable Development Goals are a tool for everyone to start to work together to look at transdisciplinary education, looking at the health and all policies, not just at a national level, but going beyond to a global level and coming back down to the community level So we have a linkage at all those three levels. And then obviously started to think about, well, how do I work with other sectors that are going to be important for me to address air pollution, to address food systems, which is again the guide the WHO has just released covers. So with that, I will hand back to Nicole and thank colleagues for the opportunity to present.
Thank you very much, Julian. I'm now actually going to hand back to Julian because after that introduction to our guide, Julian is going to be facilitating a panel discussion with our four panelists. We have Andrew Hoffman, Dean of Veterinary Medicine at the School of Veterinary Medicine from the University of Pennsylvania. We also have, as I mentioned previously, Rayana Buhaka from the Government of Qatar. We have Thorkild Telleska, Professor of Pediatrics and Global Health from the University of Bergen, Norway. And then we also have Onyema Ajubo, who's a technical officer in the Health Workforce Department, from WHO Geneva, who will also be interviewed or contributing to the panel. So thank you all to the introductory inputs. And now I'm going to hand over to Julian, who's going to facilitate some panel questions.
Thank you very much, Nicole. And Dr. Hoffman, a little introduction. Dr. Hoffman is the Dean of the School of Veterinary Medicine at University of Pennsylvania in the United States. So Andrew, you and I have been working together on with the National Academies working group, looking at One Health and perhaps how One Health and the definition and the concept of One Health can be expanded, particularly with all the issues that we've been discussing, and obviously looking at external issues like increasing the inclusivity of the definition and the concept. So could you tell us how this work might play into a transformational role in equipping students in health in other disciplines outside health with the competencies they need to act on the social and environmental determinants of health?
Thank you, Julian, and thank you to the WHO for this wonderful session. This is a very important question that you're asking. The social determinants of health, workforce training will require a new framework, which, as Zeke mentioned, needs to be incorporated into climate and health education in the context of social determinants of health. So our work that Julian was mentioning at the National Academy of Medicine, Engineering and Science builds on John Parrish-Sproul's group, who published an analysis of One Health in Frontiers in Public Health 2023. The study by Mumford et al. Identified gaps in a widely circulated One Health framework that we've all heard of and appreciate. The One Health framework links humans, animals, plants, and ecosystems in sort of all sorts of activities surrounding health and biological sciences traditionally. The One Health framework was first developed by veterinarians, as he mentions in the paper, to link health of animals to humans and the environment, that they were interdependent, for example, with respect to transmission of zoonotic diseases. And later, the acknowledgement that there are disease syndromes that humans and animals share, like many cancers, including the health benefits of biodiversity to animals and humans, the impact of human-animal interactions on well-being, and it's grown into various areas such as agriculture and food systems. So if we just think, for example, complex examples of climate impacts on One Health, including rising waters and dams that are impacting salmon runs that are critical as cultural and food resources to indigenous people, extreme weather events and the flooding that results, mobilizing contaminants and even antimicrobial resistance factors that can leach into croplands and grazing pastures, affecting our food supply. Note that all of these complex problems involve populations, public health, and the social determinants of health. So new competencies to respond and to prevent further harm to animals, people, and ecosystems are needed. So Parrish-Sproul's group that we're building on described the limitations of the One Health framework as an educational and an action framework. So in a threefold manner. One, there are limitations of scope of One Health is such far limited to health and biological sciences. But thus far, the framework has largely excluded the social sciences, humanities, and traditional and indigenous knowledge partners. The second limitation identified that we're working to remedy is in the approach to One Health, which currently lacks attention to the connectivity between all of the fields, the complexity, the unpredictability, and the nonlinearity of these complex systems. And three, the framework is limited in the world views that are included and applied. So it's currently One Health has been over-reliant on mainstream or Western reductionist type science and has excluded cultural norms and values, belief systems, and traditional knowledge or practice. In other words, One Health could be more holistic and interconnected. Overall, there's a sense that One Health, even the SDG frameworks, need to become more multisectorial, transdisciplinary, more interconnected in order to best serve climate and social determinants of health education. So our call to action, and the call to action in Parris-Sproul's paper was to assemble a group to breathe new life into the One Health framework for all of us, mainly to broaden and to connect elements of One Health and ultimately to produce a toolkit for operationalizing One Health for all. Ultimately, to use One Health framework to apply to a variety of activities, including climate or other research, education, regulations, or policy development, negotiations, and global governance. In brief, our working group has thus far identified an expanded checklist, for lack of a better word, of components and touch points within One Health, partners and methodologies, and greater connectivity of the elements. The expanded areas of scope, for example, include equity, justice, and rights, mental and spiritual well-being, accessibility and ability, leadership development, economics. Additional approaches we've identified include complexity science, implementation science, earth science, technology, and in expanded areas of worldview must start to incorporate indigenous and local knowledge and partners, co-production of knowledge, and perhaps flexible participatory research, sort of meeting people where they're at in research. Bringing together these elements is particularly important to climate change policy as it relates to the determinants of health. In some ways, the impact of an expanded and interconnected One Health framework is a hypothesis. So we will seek to test the evolved framework using case examples. So that's our goal number 2, which will augment the learning environment and the participation of instructors in the health field, which is challenging. Further, we're preparing to communicate those findings in the published reflection and as well as an actionable framework for health professionals. So lastly, to finish up, to address the social determinants of health will require us to build resilience through a One Health lens. The expanded One Health or 2.0 or more evolved framework and more actionable framework that we seek will lower the barrier for the application of multisectorial and transdisciplinary education and strategies by expanding the scope, approach, and worldview of elements for addressing the social determinants of health. And I can leave you with a concept that might simplify these efforts, a world where health integrates everyone, the entire workforce, rather than a strictly human-centric paradigm. So thank you.
Thank you very much, Andy, and it's a great note to end on that idea of inclusivity in terms of broadening and going beyond what we see as health, the One Health idea, but also revisiting the need to listen to everyone and be inclusive in our education and research. So real messages, really important messages coming through, and I'm looking forward to continue that work with you. So thanks very much, Andy. Now turning to Dr. Enuma Adjebo, who's the technical officer at the WHO, and Enuma and I have been working extensively on this book for many years. So Enuma, if I can ask you, what do you see that we need to perhaps revisit, to change in health and learning systems to start addressing the complex challenges around climate change? And do you see there's a one size fits all, or do you see there's multiple options that are needed?
Thank you, Julian. I wish that we had a silver bullet for for this challenge, but we don't, and that is part of what we want today to communicate to educators and designers and developers of health education and learning programs. I really like what Dr. Andre spoke about, talking about the One Health lens and the multisectoral and transdisciplinary nature of the intervention that we need to solve this crisis. And once you couple those words together, you're talking about a real complex scenario. And just referring back to Jean's earlier keynote where he was talking about the public health workforce. It's interesting because in the book, Julian, we use 3 levels to describe the role and the kinds of health workers who would typically intervene in such a scenario as tackling climate or planetary health, as it may be. We have those at the national level who would actually work on policies at that level, the champions and the leaders. And for instance, we saw a number of them at the COP28 and in this kind of meetings. We also have another category of health workers who are at the more administrative district level. So, for instance, we talk about in WHO low carbon and resilient health systems. And there needs to be competencies that help the managers of these facilities need to understand what they're doing and how it relates to how climate situations are addressed. And then at the individual or community level, we have the health workers themselves who are in contact with individuals and communities who are affected by the effects of climate change. So you may be a nurse or a doctor, depending on where you are, attending to somebody with a heat stroke or attending to somebody with a frostbite or people who've been overwhelmed by floods. So I think the message we do really want to send out today is that this is a very complex scenario, and there are multiple layers of workers with specific and unique competencies. And we need to start to understand that we need to design programs that are competency-based, that can address the task that they need to deliver, but also can help them understand how they relate to each other, whether it's within the context of the health in all policies or how feedback is taken up, whether in the development or in the progress in the design of the learning programs. So it's a complex scenario, and we're asking educators to be very conversant of this. Thank you.
Thank you much, Anima. And again, it really sort of reinforces the point that there is no one size fits all. And as Dr. Hoffman was saying, we're starting to look at broadening new terminology, new ways of developing these conceptual models that go beyond and give us the ability to start working in a more complex environment. So thank you very much, Anima. And I'd like to now turn to Dr. Tillisar from the University of Bergen. Torgild works at the Center of International Health and at the Department of Global Public Health and Primary Care. And we had a conversation several days ago particularly in terms of the barriers and challenges of integrating the social determinants and taking public health or global health and integrating it into the mainstream conventional health workforce programs. Torgild, perhaps I can ask you for your thoughts and your experiences, because you've had 25 years of teaching in many different educational institutions around the world. What are your thoughts about how we might take some of the ideas that we've been discussing and actually implement them, and perhaps overcome some of those barriers that up until now we've been facing and we need to rapidly overcome?
Yeah, let me start by quoting Rudolf Virchow, who says that medicine is a social science and politics is nothing else but medicine on a large scale. Medicine as a social science, as the science of human beings, has the obligation to point out problems and to attempt their theoretical solution. The politician, the practical anthropologist must find the means of their actual solution. The physicians are the natural attorneys of the poor, and social problems fall to a large extent within their jurisdiction. These are old words, but I think perhaps the anthropologists have some problems with it. But I think the definition of medicine as a social science, and that social problems are also part of medicine, I think is very true. And even more so nowadays when we are facing global challenges. And at our university, we have 3 priority areas. Ocean, because we are a coastal country, climate and energy transition. We are also oil producers, so we are working on these issues, and global challenges, looking at the global challenges that we have in the world. Therefore, we have an SDG conference annually. We have courses for the SDG agenda, or the 2030 agenda. One of them is global health, and it's called, if you look at the course code, it's called SDG 303. SDG 3 obviously is the SDG for the health area. And these courses are open also to other people from other faculties. We have on these social determinants, we have the Bergen Center for Ethics and Priority Setting in Health, which is a center of excellence that contributes a lot to the WHO agenda on the social determinants and how to address them. And here in this release now, WHO is trying to unify several of the very big topics, which is of course a major task. And how are we addressing this here? I think making people aware of the problems is relatively doable. And we run every year a summer research school with a focus on global challenges. This year, we are focusing particularly on education. And this is also a focus on how should we convey the global challenges to also primary school children and secondary school children and in the university teaching. So these are all areas where we work. At the center where I work, we are a bit privileged because we are doing postgraduate training where people come with their basic degree in medicine or nursing, dentistry, pharmacy, nutrition. And here we can put the public health and the One Health more into the focus. And in that sense, we can now give people the awareness. But I think the challenge that is in a way we are all put at, how do you convert this into action? How should you make the doctors also become the attorneys of the poor? I mean, the saying is that if you have a message for the doctor, you write it on a check. And very often doctors will tend to go for the money and not for the poor. And I think here is the big challenge of this report or this publication and the challenges ahead. Thank you.
Thank you much, Torgeir. I mean, the degree of honesty, and we need to address all the different changes in mindset, and that can be done best through education. So a fantastic overview of what you're doing up in the University of Bergen, and great to see the Sustainable Development Goals and social determinants being taught in such a broad, multisectoral way. So thank you very much for that. I'd like to turn to Dr. Rihanna Haka, who's the head of WHO Country Office and the WHO representative to Qatar. So, Rihanna, I'd just like to ask you, as a top diplomat to a country that's really making some great progress in the area of health, workforce education, and addressing climate change. What are some of your perspectives, some of your thoughts, and some of ideas that you've been seeing in your work with Qatar? And do you think some examples from Qatar could be taken and used as case studies and learning for other countries, who are, as we've been hearing, been facing similar problems?
Thank you very much, and I'm very happy to join and pleased to not only listen to the different panelists and interactions, but also to think about the work that we have done jointly between us, WHO, and also the Ministry of Public Health, plus other sectors on during the preparation last year for the World Cup, but also as part of the Healthy Cities program. So we had not benefited, unfortunately, from of course, the handbook and the guidelines being already out, but because of really practical exercise that we did with all the municipalities in Qatar for the Healthy Cities awarding under the program that we have in the Eastern Mediterranean Regional Office. And we worked jointly with the mayors and with the medical health teams, but also multisectoral approach, health in all policy, to look at each city and look at the complexity of the indicators that are there from the various sectors that would contribute to make at least a healthy city, or would be at least putting them into a plan of action that would develop towards the healthy cities. And to award a city or municipality, we needed to have at least 80% of those indicators developed and available. So there was a work done, and plus I think involving those different teams in the Ministry of Health and municipalities with the mayors and with a multitude of other sectors, without having the guidance, of course, of how to do that, was maybe not easy in the beginning, but with a competitive aspect to it, like, okay, we wanted all the cities to be awarded. That provided more motivation and also more exercise to the central team who was working on that domain. So there was a lot work done on how to make sure that the city is providing nutritious food, having of course, food safety implemented, nutritious guidelines developed, green spaces, and so on, and physical activity. And that culminated during the work that we were doing for the World Cup FIFA 2022 last year, in terms of the multisectoral, both preparedness from a mass gathering, but also for handing over or delivering a healthy World Cup as much as, of course, possible. So there was work developed along with the providers of food outlets on the nutritious food, nudging in certain ways and in stadia, and learning from that behavior and developing the guidance about it. There was also coordination teams working on environmental assessment, on working sure that the emergency services are networked with the other services, that there was, of course, all the stadia were banning tobacco during the World Cup games, and there was a lot of communication about physical activity, importance to the community of making sure that there is more physical exercise, and importance of this through arranging green spaces and making sure that there was activities. We did walk the talk around that as well. There were also aspects about questions on NCDs and about how do you manage your health through digital applications with Florence. You remember Florence? We had it for tobacco, and that was adapted also for that purpose. And also establishing for each country that were in the finalists mental health benches, whereby they were put around the stadium, and they would friendship benches that would support mental health discussions and making sure that people also community come together and support each other. The transport department also worked on metro and worked on making sure that there were long, easy ways for people to walk more towards the stadia, and in that aspect, at least supporting physical activity. Of course, it was not done yet with climate change agenda, but at least now when we are talking with all the healthcare providers at various levels and also with the regulators, there is much more readiness to look into developing the plans for decarbonizing the health sector, to look at how we can improve on the behavior of everybody at different levels. And this is where at least the guidelines will help us in many ways. There is also uptake a lot on the legacy aspects and taking that forward from a sustainability approach, looking into research and also adopting the One Health. I can talk a lot about all of those, but I will stop here. And if there is any clarification, I'm ready to give that. Over to you. Thank you.
Thank you very much, Rihanna. And actually, it's a very, as I was listening to you, it struck me that in a way, what you're describing, those events that people have to come together to organize, is a very good way of an educational piece, that you can take practical examples that people are going to have to do, and you can work through these things. And then, as I say, with Dr. Hoffman, that will encourage health workers to go beyond what they think about health, because they're going to come into contact with people working in, as he said, veterinary science, and all of a sudden it triggers some thought processes. Well, actually, okay, that is a health issue. I didn't think of it initially, but now I understand it. And then, as Torgils was saying, bringing it back to the Sustainable Development Goals. So you've got the theoretical kind of structure, but you're then putting it into practice, that you can actually say, fine, I know now how to work with other people. And as he was saying as well, the idea of the doctors in his Vishal's description of representing communities that are vulnerable, that are perhaps not able, don't have a voice themselves. So I think a really good example of how we can learn from what you're doing in Qatar, and say, in actual fact, taking these concrete examples and then breaking them down, as Dr. Hoffman was saying, and turning it into a transdisciplinary learning exercise. Maybe that is something, a takeaway from today. So from my side, thank you very much.
Sorry to cut you, but I just wanted to add that also we had all the municipalities labeled as healthy cities, but also Education City and Qatar University. And that opened another, if you want, scope onto what we can do more in the next few months coming ahead. Over to you, and sorry to cut you. Over to you.
No, and that's a fantastic point to end on. That it's important to go back down to the local governments, the municipalities, and then see different sectors working together. So I think it's a great point to end on. So Nicole, I'll hand back to you to perhaps summarize. Oh, before I do so, thank you very much for all the speakers and for you taking the time and presenting with us today. So thank you very much. And Nicole, I'll hand over to you for the final closing remarks.
Okay, thanks, Julian, and thank you to all the panelists and the speakers who set the scene as well. One of whom had to leave a little bit early. He sends his apologies. Thank you also to our participants for being here to listen to this debate and discussion around education. I think I'm struck by the challenge of converting a health workforce that might be more oriented towards notes they receive on checks, as opposed to being attorneys for the poor. I think that's quite a very blunt but stark reality, that the social determinants are operating within the health systems themselves with perhaps perverse incentives in many cases. So confronting that, I think, is a challenge for us as a health sector. And we cannot contribute to addressing climate action and climate change in a positive way unless we also address those incentives, that we have the right incentives to become attorneys for the poor, because we know that the people most affected by climate change are in fact those who are living in worse conditions generally, socially, and who have less power socially. So I think this really actually gives me more inspiration to really champion the social determinants of health in health workforce education in order to contribute to some of these major challenges we're all facing related to peace, the planet, partnerships, and even prosperity. So with that in mind, thank you, everyone. And I hope that this will be the first of several sessions, because I think we need to dialogue more about the education sector. We need to dialogue more about the kinds of health workforce that are being produced and having them with the competencies and having the right kind of jobs available as well. We need to look at things both from the employment side as well as from the education side. So thank you. There's a lot that we covered. There's a lot more that could be said, but in the interest of time, I'm going to close the session now and look forward to further opportunities to discuss this topic again with you all. Okay, bye for now from WHO and from the team here. Thank you, Julian. Thank you, Onyema.
Thank you.
Thank you very much.
Thank you,
Bye,
everyone. Bye-bye.
Bye.